Honest and fearless, here's everything you need to know to jumpstart your day this Saturday, March 20th. I'm Riza Diaz. Over a year into the pandemic, around 7,100 new COVID-19 infections were logged on Friday, the highest single-day tally since the pandemic started. With this, total cases surged to 648,000, of which over 73,000 are still active cases. The health department also posted a positivity rate of 15%, the highest since April of last year. Total COVID-19 fatalities reached 12,900 as 13 more people died of the virus. 390 more people recovered from the disease, pushing the death toll to 561,000. The UP or the OCTA Research Group predicts 8,000 new COVID-19 cases by next week and 10,000 cases every day by the end of the month. In an interview with the chiefs, Professor Guido David says, while this high number is so disheartening, there may be a silver lining by June. He says if this trend continues, Philippines will have developed herd immunity by the month of June, before the vaccines could even take effect.
The figures show na yung projections namin, they're still on track. So we will probably see mga 8,000 by sometime next week. I mean, that's the reality kasi at this height of the cases, mahirap i-reverse to. Hindi siya basta-basta mag-reverse. It has the momentum right now to increase. And we're gonna see most likely at least 10,000 cases per day by the end of the month. I was looking at the numbers and I saw a silver lining here.
Okay.
So it looks like a silver lining is if this trend continues by June 30, we will achieve herd immunity. So we will have infected 8.5 million people in NCR that will give us herd immunity.
With such alarming figures, the government should implement enhanced community quarantine now. That's according to San Lazaro Hospital infectious disease head Dr. Ronchin Solante. In an interview with One News Now, Solante says the recent uptick in COVID cases warrants a hard lockdown in the metro. He adds that hospitals may now be overwhelmed from the spike and preparedness to handle the virus may be moot as the high caseload may cause fatigue among healthcare workers.
The cases now is more or less higher than what we experienced before in last year's July or August. So this is the highest, and we don't want this to escalate more in the next 2 to 3 days because that will really overwhelm our healthcare facilities. If half of this is in Metro Manila, then I would say a lot of these hospitals now are more or less above the capacity of the allotted beds for COVID-19. If you have your bed capacity is 150 and you're handling 200 cases and half of these are critical, even if you know how to manage, it will still boil down to the fatigue and burnout of healthcare workers.
But the OCTA Research Group says the government is unlikely to impose another hard lockdown. That's why the group is urging the public to go on a quote voluntary ECQ. Professor Ranjit Rai said that the public should reduce mobility to bring down the cases. OCTA earlier proposed a circuit breaker lockdown or hard GCQ to deal with the rising infections.
The government won't close down, and for many reasons, then we have to take it upon ourselves, as usual, to do a personal voluntary ECQ.
The government tightens restrictions once again as Philippines logs record high new COVID-19 cases. Among the businesses prohibited to open are driving schools, museums, libraries, and other enclosed public places. Maricel Halili has the details.
Starting today until April 4, operations in driving schools, traditional cinemas, arcades, libraries, museums, and cultural centers in all areas under General Community Quarantine or GCQ will be suspended.
Yung mga sasakyan namin, hinuhulugan namin yon. Nandun po yung time na talagang dapat magsasara na kami. Kasi syempre, 'di ba ang hirap tapos kahit naka-lockdown or sarado kami, yung mga office namin po, tuloy po kasi ang bayad nun.
There will also be limited mobility in tourist spots, except for open-air attractions. According to IATF Resolution Number 103, essential business meetings and religious gatherings will be limited to 30% venue capacity, but local governments may expand the capacity for religious activities to up to 50%, depending on the situation in their area. All restaurants and personal care services will be allowed to operate at half capacity, while cockpits will be suspended even in areas under modified GCQ.
Sinusubukan po nating ipababa talaga ang numero ng COVID cases na hindi po nagsasarado ng malawakan ng ating ekonomiya.
Health Secretary Francisco Duque III said implementing targeted restrictions to minimize the mobility of people is better than resorting to a total lockdown.
It's part of the circuit breaker concept. More targeted restrictions without resorting to a widespread lockdown.
While the IATF has not approved the imposition of circuit break lockdowns, Roque did not deny the possibility of a stricter quarantine.
As a last resort, pwede tayong mag-increase ng quarantine classification pero napakadami na nga po nagugutom kaya kinakailangan buksan natin hanggang maaari ang ating ekonomiya.
Taking back a previously announced travel policy, Roque clarified that all Filipinos and not just OFWs will now be allowed to enter the country. But all foreign nationals will still be barred entry from March 22 to April 21, with exception to diplomats and their dependents, those involved in medical repatriation, and foreign spouses of Filipinos. Inbound passengers at the Ninoy Aquino International Airport are still limited to 1,500 a day. For News 5, Maricel Halili, We Are One News.
Malacanang is limiting the number of on-site personnel in government offices in Metro Manila and other areas under GCQ. The memorandum circular signed by Executive Secretary Salvador Medildea directs that all government agencies should observe a 30% minimum and a maximum of 50% operational capacity. Agencies providing health and emergency frontline services, border control, and critical services which need higher operation capacity may be exempted from this. The palace is also considering all government agencies to get approval from the Office of the President if they are eyeing to temporarily close due to the rising COVID-19 cases. We'll be back with more stories after the break. Keep it here on One News. You're still watching One News Now. I'm Riza Diaz. The Food and Drug Administration has granted Russia's Sputnik V vaccine emergency use in the country. The jabs can also be used on senior citizens. The latest updates on vaccines in this report by Greg Gregorio.
4 COVID-19 vaccine candidates may now be used in the Philippines. The Food and Drug Administration granted Gamaleya Institute Sputnik V emergency use authorization. Data shows that the Russian vaccine is 91.6% effective overall. It's fully effective against moderate and severe COVID-19 cases. It requires 2 doses with a 21-day interval.
After a rigorous and thorough review, the FDA is granting emergency use authorization to the Sputnik V GAM-CoV-Vac.
The government seeks to procure at least 10 million doses, 2 million of which may arrive next month. It may be used on adults aged over 18 years old, including senior citizens.
If you read the Lancet report, about 1/4 of them had comorbidities, no, and 10% was for senior citizens. And it showed that the efficacy of the drug was quite uniform among all age groups.
So far, aside from Sputnik V, only Pfizer and Astrazeneca are locally approved for the elderly. As for Sinovac, Vaccines Czar Carlito Galvez said they're still waiting for data.
Sa ngayon nakikita po natin na medyo mahina po yung side effects o may tinatawag ng very mild na side effects ng Sinovac. Nakikita po natin na baka pwede po rin po talagang gamitin po ito sa mga seniors.
Speaking to Radyo 5, he claimed that 11 of 15 countries have inoculated senior citizens with Sinovac. The FDA is open to revising Sinovac's EUA if necessary.
It will be up to the manufacturer and the distributor of Sinovac to provide data that will show that they have tried it in people who are above 60 years old and that it is safe for use.
Galvez says 400,000 Sinovac donations will arrive March 24. 1 million Sinovac shots bought by government will follow March 28. About 900,000 doses of Astrazeneca via the COVAX facility are expected next week. President Rodrigo Duterte has approved the use of all on-stock Astrazeneca shots as a first dose to all medical frontliners. For News 5, Greg Gregorio, we are One News.
The FDA once again warns senior citizens may not be inoculated with Sinovac. FDA Chief Eric Domingo reiterates Sinovac's emergency use authorization provides that it may only be administered to people aged 18 to 59 years old. This was after vaccine czar Carlito Galvez Jr. announced that up to 9 million senior citizens will be inoculated with Sinovac next month. Even worse, earlier this month, 10 elderly doctors from Cardinal Santos Hospital and one from Governor Roque B. Ablan Senior Memorial Hospital in Lawag City already received Sinovac jobs. Now, the country's mayors said their appeal to be included in the priority list for vaccination has been granted by the IATF. The League of Cities of the Philippines lauded the IATF decision, which reclassifies local chief executives as essential workers to be included in the list for vaccination. This means that thousands of provincial governors, mayors, and barangay captains will be included in the category A4 priority group. The Health Department will take back all AstraZeneca vaccines distributed in the provinces to provide more vaccines for the metro. According to presidential spokesperson Harry Roque, this is due to President Duterte's request to utilize the COVAX donated vaccines for Metro Manila frontline health workers in light of the recent surge in new cases. Health Secretary Francisco Duque says the first set of vaccines to be recalled will be from areas with low number of cases as to prevent expiration of the doses, which are set to expire by May 31st. Meanwhile, President Duterte has approved the use of all AstraZeneca shots as first dose for healthcare workers. This means that the country will use all available 525,600 AstraZeneca vaccines from the COVAX facility as first doses instead of setting aside some doses for the second shots. Presidential spokesperson Harry Roque said the move aims to protect a larger number of medical frontliners in the areas with seen increased transmission. The country has started to administer the Oxford-made shots after their doses arrived this month. This move shows confidence that the next batch of AstraZeneca orders will not be delayed and will arrive in time or within the 3-month window between the doses. And that's how the day is shaping up to be. Join us later at 10 in the morning as we continue to monitor the day's biggest stories from sunrise to sundown. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. We are One News.